Good day! I am Carmela Alavazo. I'm back again here at CSA Medical Aesthetics. And I think it's a year ago na with my session with Sculptra. And as you can see, there are changes. I was looking back yung mga videos ko in the past. This is my third. And then there is really a big difference. Okay? So, talagang nag-lift po talaga yung face ko. As you can see, meron na siyang laman. Nagkaroon ng laman. Unlike before, when I did not undergo any sculpture treatment. As in talagang super lubog po talaga yung dito. And aside from that, I've just noticed, just recently, nito lang, every time na, syempre, ang mga girls, they will have the monthly period. In the past, kapag nagma-monthly period ako, nagkakaroon ako ng tigyawat, and there will be black marks. But I've just noticed, nung nag-undergo ako ng sculpture treatment, nagkakatigyawat, syempre hindi maalis yun, pero hindi makikita yung black marks nung siguro part yun nung kasama siguro yun. Aside from bibigyan ng laman yung face mo, magiging youthful, naging parang isang part nung yung mga ang tawag dito, acne treatment, acne marks na nabawasan, okay? And I believe hindi nabawasan, talagang hindi ko na nakikita every month. Okay. So yun po ang kagandahan ng sculpture treatment, and I am so excited again today being back here at CSA. Ano na naman kaya ang treatment, or ano na naman kaya ang latest? Don't forget to subscribe and click the notification button bell for you to be updated of the latest trends here at CSA Medical Aesthetics.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's welcome Ma'am Carmela Alavazo.
Hello po.
Welcome back.
Po.
So, like a year ago, we did procedures called the Sculptra treatment. And we know Sculptra is made up of your poly-L-lactic acid. And these are your collagen biostimulators. And we only did 2 sessions for her. Like, the first one was a month of March, right? And the second one was a month of April. And we haven't done a 3rd session, which ideally we should have done, okay? But for now, okay, reassessing Ma'am Carmela here, like I've seen a restoration of volume, especially on the temple and then the zygoma, subzygoma area, and a part of the mid-face section there, and a part of the lower face also, okay? So for today, actually, what I have seen on her right now is the center of the face, okay? We did a correction on the sides, so the lateral aspects. When you already improve the lateral aspects, you're kind of like also giving that strengthening of this so-called non-mobile zone. And when you're strengthening it, when you're stimulating collagen there, you're restoring, tightening, and firming. And at the same time, it's kind of like having a lifting effect for the mid-face section and also a restoration of the volume. Right, Ma'am Carmela?
Yes po.
How are you so far po?
Okay naman po.
Okay naman. But she's so busy. She's so overworked. Like in the past, we've known that she's working like graveyard, right?
Okay.
Night shift. And you know, that kind of job, it like will accelerate aging. It accelerates the volume loss, the wrinkling of the skin, the loss of collagen, loss of elastin, okay? So it's kind of like causing the aging signs, okay? And how young are you now?
46.
Okay, 46. Oh, I'm 5 years older. Anyway, okay. So for today, my focus will be on the forehead area, okay, the glabella portion here, and also the under eye area there. I want to improve the under eye. And for now, we already do also nose rejuvenation to kind of improve the periorbital region and also the nasolabial fold. And I'm checking also on her chin. We want to assess the so-called Ricketts E line, okay? So we will be doing a procedure so-called combination of your hyaluronic dermal fillers plus your polydioxanone threads or your PDO threads, okay? So what do you think, Ma'am Carmela?
Excited.
So far, so good, right? So this is a treatment whereby we just want to restore our youthful look, okay? We used to be very young looking, okay? So you just want to restore. And at the same time, refresh our looks, rejuvenate, and also regenerate, because the aging is like the 3-letter D's. D's for the first D, descent. The second, descent is the going down, the sagginess. The second D is so-called the deflation, so-called volume loss. So the collagen, elastin, hyaluronic loss, the depletion of those connective tissue fibrous proteins, okay? And the last letter D is the so-called degeneration and degradation. So nagde-degenerate mga soft tissues, skin tissues, even up to the bone degradation, nag-shrink lahat. So what we're doing in these kinds of like aesthetic procedures is to regenerate, to refresh, to restore or replenish what we lost when we were younger. Okay. So ideally, like how many years younger, Ma'am Carmela? The goal is?
The goal is
10 years, minus 10 years?
Minus 10.
Okay. Ako kayo nasa minus 1. Okay. Anyway, so we will show you the actual procedure when CSA Medical Aesthetics returns. And so we're back. We're with Ma'am Carmela here. So we're doing a so-called full face rejuvenation for an optimal outcome. So I'll start with the upper third of the face. So we'll work on the forehead region. Okay, I'll be doing a combination of my filler and threads here. So I'll have entry points on the superior aspect of the forehead here. So I'll anesthetize first. So as with any aesthetic procedure, we have to clean the area. Okay, make the field sterile, and then we also applied numbing cream, like a lidocaine cream. We left it for about like 45 minutes, okay? So I'll start with the upper part here. I'll make an injection of my lidocaine for my entry point here. So I'll be using a low molecular weight type of my hyaluronic dermal filler because the forehead region is a thin area, so we need a thin type of a filler also. So I'll make my first entry point here, and I'll use my cannula, and I have a low molecular weight hyaluronic substance here. So here's my entry point. There you go. So this is a gauge 22. You can use gauge 23 up to gauge 25 cannula. So take note, you have supraorbital as well as supratrochlear vessels there. You have to be very careful, avoid them. So it's safer to be using cannula here. So I'm just gonna glide the cannula towards the center of the glabella there. So I need to fill this in because she already has the deep static lines in the glabellar area. So I'll make my first linear thread there. And then it's like a fanning technique here. So for our doctors, you have to go on the deepest plane, deepest anatomical layer there. So I'm just gonna make a so-called fanning technique there, okay? Gently and slowly. So when we do our dermal filler, we wanna stay in the safe anatomical layer. We wanna use the correct correct anatomical layer, correct technique. So we'll have a good result here, a good outcome. So I'm just doing a so-called like a fanning method there, okay? So being gentle also. So I'm staying on the bone layer there, okay? So I can combine this with my PDO thread. So I have a PDO thread in a 60mm cannula here. So I'll use that, direct it here. Okay, so I want to pull this medial aspect of the brow here. So I can start here, place it there, okay. So since Ma'am Carmela also had this lines, static lines already, okay, I'll start with this one. And the next one will be on the opposite side, okay. Actually, I'll be using 3 entry points on this forehead region, okay. I'll just glide it towards this eyebrow area there, inferior part. Okay. So we want to pull the tissues there. Okay, then out. Okay. So I'll be continuing with my filler again. Fill in this left side of the forehead there. So I have my entry point here. I did an injection of my lidocaine a while ago. Okay, I want to re-inject lidocaine again to make sure that I have numbed the correct entry point here. So this part here, just a tiny amount of your lido there, and then we'll make a tiny prick there. So I'm using a gauge 21 introducer there, and this is your gauge 22 cannula. You want to go to the safe anatomical layer there. So first, a linear approach there. Okay. So be careful with your supraorbital and your supratrochlear structures there. So you want to fill this in. So a fanning technique again, okay? You're still good, Ma'am Carmela? Okay, good. So you want to restore the convexity of your forehead. So ideally for women, we want to have this good shape of our forehead. So to be youthful, you have to have that good forehead projection as well, okay? So gliding the product there just a little bit. So for those who has this kind of volume loss on the forehead region already, you can use this technique also. So with this entry point, so I want to do like a pattern that's so-called like an X pattern with my thread there. So I'll go on the medial aspect, medial eyebrow of the opposite eyebrow there, and I'll just direct it in that medial eyebrow there. Okay, so it's like a letter X pattern there. Okay, so the next one will be here. You're still good, Ma'am Carmela? Good. So this is my last part here. Let me just use another lidocaine injection there just to make sure that my entry point is numb here. So this is my entry point for this part here. So I noticed that she has a volume loss on the lateral aspect of the right forehead area. So you want to refill that. Fill it in with your hyaluronic substance. So we have hyaluronic in our tissues. So it's a material that is so natural. It's present in our system, okay? So I'm already doing like an anterograde approach there, okay? So you may want to fill this in. So I'm using, again, hyaluronic. There are cases that I use like a Radis calcium hydroxyl apatite, the one that we have to hyperdilute. So for this one, it's a soft filler, thin filler. Okay, you're still good, Ma'am Carmela. She has a scar here. So I'm kind of like doing also a subcision already to correct the scar on the forehead area. Okay, for scar, you may want to combine it with some laser procedures like fractional CO2 lasers to improve the scar on the skin. Okay, so she has some childhood scars, right, Ma'am Carmela? When we were young, we used to play a lot in the streets. Nowadays, kids don't play in the streets. They play indoors with their gadgets. So right now, it's more of an expensive games for kids. But when we were young, I remember, because Carmela is my younger sister, we were just outdoors playing those outdoor games. And it was like a lot. For me, it's more fun doing outdoor games. Okay, so I'll use my video thread. Okay, so actually you can still combine the procedure with your botulinum toxin to relax the frontalis muscle. So I'm going on the opposite eyebrow already, the medial brow, opposite area there. So I did a cross, kind of like a cross pattern or an X pattern there. So I want to reach the opposite medial brow there. There you go. So now we'll be cutting the remaining strands, the exposed PDO strands here. Just press on the skin, and this one too, and then just press on the skin. And there you go. So this is for the forehead rejuvenation. Now we can do also an under eye rejuvenation. Okay, I can use a combination again of my filler. Okay, so this is a procedure we call combination. You can make a prick here. Okay, so you can use a vertical line and a horizontal line like that. The intersection area will be your entry point for your under eye treatment. So again, for the under eye, you can use a low molecular weight type of your hyaluronic substance there. You don't want a thick one, you only want a thin one because the skin under the eye is so thin. So you just want to restore volume in the under eye, especially the so-called tear trough region. Okay, So the ideal plane now here is a deep plane. So you want to go submuscular below the orbicularis oculi muscle. So placing a tiny aliquot of my hyaluronic substance there. So just a small amount. She doesn't need a lot because she doesn't have that very severe type of under eye problem. She's just young, 5 years younger than me. Okay, so after this dermal filler, I can proceed to the PDO thread. So again, this is a combination. We need filler for instant volume, and the threads are for collagen stimulation to strengthen, tighten, and firm the skin tissues. Okay. Now I have my lidocaine here, which I will use to numb the entry point for my thread. I'll be using the Socal PDO mesh. So we have a new type of a thread here, the Socal PDO mesh that I can use for the tear trough correction. Okay. So this one is a mesh. It's like braided type of your threads. In one cannula, you have like several strands of threads already. Okay, bevel down and then go towards your Socal tear trough area. So this is a thicker one. So kind of I'm just be gliding it and gently rotating it. And the goal is just to leave the PDO strands of threads. Again, this is a braided type, and you want to go deep plane in this area here. I can use like a 1 or 2 of this mesh type of thread. This type of thread you can also use on those deep forehead wrinkles, deep forehead creases there, then pull out, and then a second one there. Okay, so I'll proceed with doing the nasolabial fold there, and finally the nose area, so we can have a very good nose projection, and also will also improve the chin projection there. Okay, so this is a final one for that. Okay, now I work on the nasolabial. I can use a filler again to improve the volume loss. So for this one, we'll use the so-called injection needle method. Okay, onto the piriform fossa. This is already deep, so just still do an aspiration technique there and make sure there's no blood in the needle hub. And then I'll just push a 0.2 to 0.3 of my filler material there. So once I filled it in, then I can do a so-called short linear technique there. Okay, short linear technique here, aspirate and push my product material there, 0.1, and then another 0.1 here. This is to improve volume in the nasolabial fold, correct the sagginess this part here, restore volume, and at the same time support for the mid-face area. Okay, now I can combine it with my PDO again. So if I have like a gauge 60 type of a mesh type of a thread, let me just measure the thread there. So I need a length that, for example, this is like a gauge 19 with the 60 millimeter length of the cannula. You can assess where your entry point will be. So it's on the lower part, and then in the entry point, you can already make your numbing of the part here. And I use my gauge, this is gauge 19 introducer needle. Just make a prick and twist. And this is my mesh type again, another mesh type of your PDO thread. Turn to the left side, please. And then this is just glided in the subcutaneous plane. You can use a subcutaneous plane layer 2, or you can even use the layer 4 there. For now, I'll be using the layer 2 or the subcutaneous plane, and just direct it towards your aller glue. And second one, then I can also inject filler on the chin apex just to improve the chin projection. So this is improving the profile of the face. Okay, so-called full face rejuvenation, and press and pull out. Then let's do a bit of my chin. So disinfect the area, please. Disinfect, and then center of the face. There you go, onto the apex or symphysis menti. And then once you're onto the bone, you can already push your 0.3, 0.4, 0.5, depending on how receded the chin is. So for example, this one is chin apex. I want to restore volume here. I can give like as much as 0.4 here. And then on the anterior aspect, to improve the projection, I can give as much as 0.3 per side. Okay, so this is delivering up to the 0.4. So you can also do the so-called towering technique for this one. Okay, I'm given the 0.4, and then I follow, because the ideal chin of females like should be within the outer width. This should be the shape of the female chin. Okay, so I'm just gonna do a center line there, and then lateral to the right side there onto the bone again, and then push like a 0.3 here. So we want to feminize the chin and at the same time restore the chin projection. And then on the other side, the 0.3, the remaining 0.3 there. And finally, I'll be doing the nose rejuvenation, or the so-called nose enhancement. Although she has already a good shape of the nose, we just want to do a nose rejuvenation. Okay, there you go. And then finally, for the nose part here, so inject the lidocaine at the tip entry point, and then to numb the entire area. I can still do my hydrodissection for her. So make the entry point, and then let's do the hydrodissection using again the gauge 22 cannula. So I'm using my gauge 22 cannula for my hydrodissection of the tissue space in the nose area. So you want to stay in the layer 4. Push a little bit of your lidocaine already there. So I'll go up to the radix. Okay, she has a good nose length there, so you just want to numb the area here, and also numb the columella space up to the anterior nasal spine. So there you go. So just tilt the columella there and push your lido. Okay, actually I also noticed that she has thin lips, so I was telling her your lips will also need some rejuvenation or volume restoration or lip contour. So this will perfect the treatment. So still she can have some lip rejuvenation there, just the natural lip that we want to have. And when we do the lip recontouring, we follow ratios and proportions, like the upper lip like 1:2 and lower lip is like 1.6, following the golden ratio. Ideally the upper lip should have a 2 to 3 millimeter projection, the lower lip is more of a volume. Okay, you're still good, Ma'am Carmela, we're doing great. Okay, so we're almost, so I'm on my 4th, so this is 5th, 6. Okay, then we'll do the tip. Okay, she has a good length. Okay, so we can use the same entry point, just direct it towards the columella, and then we'll place 2 pieces of this short threads or columella threads that I call, and up to the anterior nasal spine, bring it out, and next one. And after this, let's go to the left side. Let's finish up with the left under eye, and after that she's good. Okay, there you go. Okay, so we've done the combination filler and threads, full face rejuvenation. We can still add a little bit on the lip area because I still have a remaining hyaluronic filler there. So far so good. I can use the letter D type of a hyaluronic substance. I can have the remaining one here. There you go. So this is like just the lip part. So when I do the lips, I want to restore the projection. I'll pinch this right philtral column there and then inject a little bit there. Then the other one here, just to make sure I create a good projection of the Cupid's bow also here. And then let's do the other side here, just the contour first. So probably let's change the needle. Hurry, because time is of essence. Okay, let's just clean the area. Okay, so far so good, Ma'am Carmela. I can already see a great improvement. Okay, so the lip contour here. So follow the vermilion border there, just a tiny aliquot of your material there. Tiny aliquot there. So you can do either a needle technique or a cannula technique for this one. So if you want to reshape the lips, you can also do the so-called, they call this a fencing technique also. So restore some tubercle there in the upper lip area there. For Ma'am Carmela, we just wanted a natural lip, not the too much lips. We want to follow the 1:1.6. So let me do the other side here. So same thing, follow the vermilion border here. Actually, the lower lip has good volume, so we just want to restore the tubercle there. Okay. So this is following the line there, and then the corner of the lip line there. And then let's just do the so-called fencing technique. And then for my lower lip, I usually use a kind of like a stick there to create the tubercle. So this is a fencing technique, so you want to add a little bit there. Plus, I noticed she has already lip cracks, so you want to hydrate the lips. And let's do the lower. Lower. So this one. So press on the center, and then I'll just do this so-called pinching technique here. And then just make your linear thread there. Bolus 1.1 here. We'll just do 0.1 there. So this is a kind of like mid to medium, kind of like a type of a molecular weight of your filler there. Okay, so we have done a full face rejuvenation for Ma'am Carmela. We'll show the result when CSA Medical Aesthetics return. And we're back. So we have done a full face rejuvenation for Ma'am Carmela. Ma'am Carmela, here's the mirror, okay? So in the treatment, we've actually also improved her lips, okay? The last part there, we added the lips because when we were assessing the lip area, there's a lack of projection, lack of volume, lack of the lip contour. There's already a thinning of the lips, plus some of the lip lines there. So we wanted to, right now, correct those lip problems, okay? So we started with the forehead, okay? We did the combination filler and threads. Then we work in the under eye section, filler and threads. Then we work on the nasolabial area, filler and threads. And then we also work on the nose. We just use the threads. We can actually still combine with the filler there. And then also on the lip area, the filler, and on the chin area, the filler. And a little bit of a touch up for some temple area there because there's a volume loss, okay? And I was assessing the corner of the eye. I told her next time we'll be doing the so-called fax eye thread lift and some skin quality improvement. Those are the next goal that we will do. Right, Ma'am Carmela?
Yes.
How are you? How are you feeling?
Great.
Yeah. So, what's your comment on the after
So cool.
procedure? Yeah.
10 years.
Yeah, minus 10, okay? So there's an improvement in the projection, nose area, forehead projection, lip projection, chin projection. So the rickets E line is already improved, okay? And under eye region, there's already improvement there. And then over time, you'll see more improvements from these kinds of treatments, the combination ones that we have done, because the filler will restore the volume instantly. The threads are stimulating collagen and at the same time strengthening and tightening your skin, plus the lifting effect, okay? So it's better to do the combination to achieve this good outcome, and at the same time, the effect will be much longer when you do your combination procedures, combination treatments. And we've done this in, like, could you say half an hour, okay? Or even less, okay? But of course, this is only a procedure that should be performed by your trained aesthetic doctors. Beware of those non-MDs doing this because there are risks in doing these kinds of injections on the face. We have a lot of vessels that are interconnected with the vessels inside, okay? So we have reports of already complications happening around us because of non-MDs doing injections like this. Okay, thank you so much, Ma'am Carmela. Yeah. And we will still follow her up, okay? Usually, of course, we check on like a week or two for improvements, further improvements. And we'll see you again. Okay. So, Ma'am Carmela, do you have a social media that they could follow you and check you?
Yeah, you can actually check on my Facebook, Carmela Alabazo, and every now and then I'll be posting my face, so at least you can follow through.
She has a good journey at CSA. There you go, the full face rejuvenation, okay? So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos. So Ma'am Carmela had 2 previous episodes, Sculptra treatment. So just look at our YouTube channel, Contessa Salvador. And thank you so much for those who have already subscribed. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.